Hi, welcome back. So in this chapter, we're going to focus on longevity, health, and functioning in older adulthood. In this lecture, we will explore the concept of longevity and its profound impact on various aspects of society. The length of human life influences a wide array of societal structures, from healthcare policies to retirement planning and insurance practices. So, for instance, decisions about government healthcare programs are directly affected by population longevity. Similarly, retirement policies, which include the very definition of retirement and debates over the age at which people may collect maximum benefits, are shaped by our increasing lifespans. The insurance industry, particularly life insurance, adjusts its premiums based on longevity trends, with longer average lifespans often resulting in cheaper rates for young adults due to extended periods of good health. Longevity contributes significantly to demographic shifts, which is partly responsible for the increasing average age of populations in many countries, including the US. So when we are discussing longevity, we typically consider several main aspects. One is the average longevity, which is the age at which half of individuals born in a particular year have died or will have died. So it's the age, again, at which half of the individuals born in a particular year will have died. This can be computed at any point in the lifespan, but it's mostly commonly calculated at birth. Maximum longevity refers to the oldest age reached by any individual of a species. So, oldest age to which any individual of a species lives. And beyond these numerical measures, we can also approach longevity from a functional perspective. So we distinguish between active versus dependent life expectancy. Active life expectancy refers to living to an advanced age while remaining healthy and largely independent. The opposite of that is dependent life expectancy, which involves living a long time while relying significantly on others or healthcare systems for assistance. And so with active life expectancy, you're essentially adding life to years. In contrast with dependent life expectancy, you're adding years to life. The transition from active to dependent life expectancy can be temporary. So understanding longevity in its full complexity requires us to recognize that it reflects a continuum between active and dependent states, highlighting the interplay between genetic predispositions and environmental influences. So we are going to explore the multifaceted nature of longevity and various factors that influence our lifespan. So our average longevity is primarily shaped by the interplay of genetics, environment, racial, ethnic, gender, and sociocultural factors. And these elements don't operate in isolation. They interact with each other in intricate ways. So for example, belonging to a particular racial group or economic class often correlates with varying levels of exposure to harmful environmental conditions and disparities in access to high quality healthcare. And so based on the combination of genetic and environmental factors, both of these are interacting to have a significant effect on our longevity. Some similar research indicates that about 25% of the variation in human longevity is due to a person's genetics. And so what we know is that genetics are a strong predictor of our longevity. And clearly these factors are interacting with environmental factors such as disease, toxins, lifestyle, and social class. But one groundbreaking project was the Human Genome Project. And so this project started around 2003. That's when they were initially reporting findings, and they completed the entire human genome mapping in 2022. And this has been a game changer in understanding how our genetics influences our longevity. And so basically, with this project, researchers mapped our genes, and all of these gaps in the original mapping were closed in 2022. And based on the advancements in microbiology and behavioral genetics, continue to produce astounding results in terms of the fact that our genetics are linked to disease and aging. And so based on this gene profile or mapping work, ongoing research is now looking at how we treat diseases by tailoring certain medications based on a specific person's genes. So an example of this is focusing on implanting corrected genes into people in the hope that good genes will reproduce and eventually wipe out defective genes. And in some cases, prevent the shortening of telomeres. And so this is what's known as gene editing, and it's being researched as a treatment to stop the growth of certain diseases or specific cancer cells in which the genetic code of a tumor in patients is individually targeted. So it turns out that this is extremely important in determining genetic factors in longevity. Environmental factors are also playing a significant role in longevity. There was a study in 2021 that was done across 20 countries and revealed that urbanization rates positively impacted longevity. Carbon dioxide emissions had a negative effect in both developed and developing nations. Other findings were that socioeconomic status, particularly poverty, significantly influenced the lifespan. Limited access to quality healthcare and nutritious food among lower income groups was also linked to reduced longevity in large-scale studies. And so, in summary, while genetics do play a substantial role in determining the lifespan, it's really a combination of environmental and genetics together that are influencing these relationships. And so understanding these complex interactions can help us understand effective strategies to promote longevity and health equity across diverse populations. So this image here outlines the various factors that are influencing human longevity. And at the foundation, we have our genetic heritage, which plays a fundamental role in determining our potential lifespan. And of course, this image emphasizes that our genes are not the sole determinants of how long we live. There's also environmental factors. So the environmental factors box illustrates the numerous external elements that are interacting with and modifying our genetic predispositions. And these factors can either enhance or diminish our longevity potential, which effectively moderate the impact of our genetic heritage. Longevity patterns exhibit significant variations across racial, ethnic, and biological sex groups. So these people of different racial, ethnic, and biological groups do not have the same average longevity at birth. Specifically, Black biological males have an average life expectancy about 4 years less than white males, while Black biological females have a life expectancy of about 3 years less than white females. This gap narrows considerably as people age. So by age 65, the difference reduces to approximately 2 years for biological males and 1 year for biological females. And what's interesting is that this trend reverses by age 85, with Black individuals tending to outlive white individuals. So some researchers have hypothesized that Black adults who reach a very old age may possess superior genetic protection against disease. And this theory is based on the observation that Black individuals generally have less access to quality health care, yet those who survive to advanced ages demonstrate remarkable longevity. However, this hypothesis fails to explain another intriguing trend, which is that Latinos or Latinas consistently show higher average life expectancies than both white and Black individuals across all age groups, despite also facing reduced access to quality health care. And so the complete explanation for these racial and ethnic group differences remains elusive. We're still trying to explore why these differences occur. The interplay between genetic factors, environmental influences, and socioeconomic conditions creates this complex web of causality that researchers are still working to unravel. There are also some sex differences as well. So biological females live about 5 years longer than biological males. Biological males are more vulnerable to disease than biological females. And typically this could be because biological males tend to be risk takers compared to biological females. Biological males smoke and use alcohol more than biological females. Biological males allow stress to enter their lives more than biological females. However, none of these hypotheses have been strongly supported. Countries around the globe are showing significant variation in average life expectancy. So as I highlighted in chapter 1, the aging is rapidly evolving in developing nations, and countries are experiencing a rise in their aging populations due to improvements in healthcare and lower childbirth deaths. We may see a reverse of these positive trends due to impacts of climate change, such as rising temperatures, dwindling food supplies, and growing income inequalities. The stark differences in life expectancy underscore the major role of environmental factors, as well as disparities in sociocultural and socioeconomic conditions. In some developing countries like Sierra Leone in Africa, the average life expectancy at birth is just 54 years. In contrast, developed nations such as Japan and Switzerland have an average life expectancy of 84 years. This gap is largely due to variations in certain sociocultural conditions, and populations in countries like Sierra Leone tend to be much younger on average compared to those in countries such as Japan or Switzerland, where the average age is considerably higher. And so there's a lot of factors that are involved in determining the average longevity in terms of what we see around the world. And of course, access to good quality healthcare is a determining factor, but it's also a combination of genetic, economic, and sociocultural conditions. The World Health Organization describes health as being in a state of complete physical, mental, and social well-being, not just the absence of illness like it was once thought. So health is a combination of social, psychological, and physical well-being. How people answer health surveys depends on various factors, including their memory, understanding of survey terms, and trust in the surveyor. So health is usually based on assessments of a person's overall self-reported health. And self-reports are pretty accurate for the most part. For example, research over the past 30 years shows that how people rate their own health can often predict their future health outcomes, and that their self-ratings generally stay consistent over time. However, issues can arise, especially among different racial, ethnic, or cultural groups due to past mistrust, cultural differences, or unfamiliar medical terms, which can affect the accuracy of self-reports. So for instance, Indigenous Australians often rate their health as poorer compared to non-Indigenous Australians due to factors like limited access to healthcare. Similarly, in the US, Black Americans are more likely to rate their health as poor compared to white Americans, and Mexican Americans and Puerto Rican Americans rate their health as poor even more frequently. Overall, while self-reports can be valuable, their accuracy can be influenced by sociocultural factors. So using culturally sensitive approaches to build trust can improve the accuracy of self-reports of a person's health. Given how widely self-reports are used, it is challenging to ensure that these measures always account for all relevant factors. Quality of life is a concept used by health researchers to assess an individual's or population's overall well-being, considering both positive and negative aspects of their lives at a given moment. This includes various factors such as personal health, relationships, educational status, work environment, social status, financial resources, safety, freedom, autonomy, social belonging, and the quality of one's physical surroundings. Health-related quality of life focuses on aspects of life affected by changes in health, while non-related quality of life covers environmental factors such as entertainment, economic resources, and cultural activities that influence overall life experience and enjoyment. Research on health-related quality of life often explores a key question. How does illness or treatment-related distress impact a person's desire to live? And according to some researchers, the answer largely depends on an individual's valuation of life, which is the extent to which they value their current existence. So the valuation of life is the degree to which one is attached to their present life and values their current existence. Factors such as life enjoyment, hope for the future, and finding meaning in daily activities significantly affect how long someone wishes to live. Understanding a person's valuation of life helps clinicians develop better strategies to enhance quality of life. Research in this field typically focuses on three main areas. One, quality of life related to specific diseases or conditions. Second is quality of life at the end of life. And third, quality of life as a measure of aging well from the individual's perspective. So older adults do experience changes in their immune system. So briefly, our immune system is a sophisticated defense system that is always on guard against microscopic threats. And so as we experienced from COVID-19, our bodies face constant threats from various foreign invaders. This can be in bacteria, viruses, or parasites. And one ongoing mystery in research is how the immune system can distinguish between our own cells and foreign invaders. And scientists believe that this process involves recognizing specific substances called antigens on the surfaces of invading bacteria or virus-infected cells. And once the immune system identifies what is a foreign invader, it will develop a defense against it. As we age, there are changes that occur in our immune function. And so older adults become more vulnerable to infections and have a higher risk of developing cancer. And so older adults' immune systems tend to take longer to build up defenses. And as a result, they become more prone to serious consequences from illnesses. And so we have a certain number of natural killer cells, which are known as NK or natural killer immune cells. They seem to increase after midlife, and overall immune effectiveness declines with age. And so even though these cells are increasing, we're still seeing an overall immune decline. And this delay is likely due to a reduction in T lymphocytes, which decrease later in life. And so this change may explain why older adults often require earlier immunizations, stronger doses, or additional boosters for diseases. Similarly, B lymphocytes also show decreased function with age. So research into treatments such as growth hormones for older adults suggests that they can help restore some of these lymphocyte functions and regenerate the thymus gland, which is crucial for immune health. However, while growth hormone therapy can enhance immune function, it may also impact the lifespan, as growth hormone deficiency, which naturally occurs with age, is associated with a longer life. And so using growth hormones involves a trade-off between improved immune function and potentially longer life. Psychoneuroimmunology is the study of how our mind, nervous system, and immune system interact to affect our health and how we deal with and recover from illnesses. This field is becoming more important in understanding how different factors like our personality traits and stress levels influence our health and ability to cope with disease. By looking at factors such as life circumstances, financial resources, and access to healthcare, we can develop better treatments that combine medication, diet, and mind-body techniques tailored to a person's everyday life. The study of these relations among psychological, neurological, and immunological systems can either raise or lower our susceptibility to and ability to recover from disease. We're going to discuss a critical shift in healthcare that's occurring due to demographic changes and the increasing prevalence of chronic health conditions. So in order to understand chronic conditions, we have to first understand the difference between acute health conditions versus chronic. Acute conditions are health conditions that develop over a short period of time and cause a rapid change in health. And so they're illnesses that often develop suddenly, and they typically last a short time, usually get resolved pretty quickly. Examples are the common cold, a flu, a virus, or broken bone. A chronic health condition is a condition that lasts at least 3 months and may result in impairment that necessitates long-term treatment. So chronic health conditions typically develop slowly over time, and they can take months, years, or even a lifetime to develop. So examples of a chronic health condition would be a diabetes, heart disease, or arthritis. And they often require ongoing medical attention. Roughly half of adults in the United States have at least one chronic health condition. And as we age, Acute diseases tend to decline, however, chronic diseases increase. And so it's important to understand that older adults, as the older adult population continues to increase, we are going to see a rise in the number of chronic health conditions. Traditionally, our healthcare system has been primarily focused on acute care. However, as chronic health conditions are becoming more common among older adults, we need to adapt our healthcare model. And so we're moving towards a system that places greater emphasis on managing ongoing health issues over extended periods. So it's important to understand that chronic health conditions can significantly impact a person's quality of life. They often make daily activities more challenging, and they can sometimes increase vulnerability to other health problems. And to fully grasp the complexity of chronic health conditions and risk factors, we have to consider them through the lens of 4 key developmental forces, which are biological, psychological, sociocultural, and life cycle factors. And these forces interact and shape how chronic conditions manifest and progress in individuals. Common chronic conditions are diabetes mellitus, cancer, and incontinence. Diabetes mellitus is a metabolic disorder characterized by abnormally high blood sugar levels, resulting from the pancreas's inability to produce insufficient insulin. This condition disrupts the body's ability to metabolize carbohydrates effectively, which leads to elevated sugar levels in both blood and urine. The severity of diabetes mellitus can be life-threatening. If blood sugar levels become extensively high, a person may enter a diabetic coma. If levels drop too low, unconsciousness can occur. There are 2 primary types of diabetes mellitus. Type 1 diabetes typically manifests earlier in life and requires insulin therapy. Type 2 diabetes generally develops in adulthood and can often be managed through dietary modifications. There are several stages of type 2 in adults, and they follow 3 main patterns. So 1 is early onset, which develops in childhood, adolescence, or young adulthood. And then there's middle age onset, which occurs in late middle age and is often accompanied by cardiovascular issues. Then late life onset develops in older age. So type 2 tends to develop later on in adult life, usually with milder symptoms. The majority of older adults with diabetes fall into the third category, which is late life onset. And the classic symptoms of diabetes, such as excessive thirst, increased appetite and urination, fatigue, weakness, weight loss, may be less pronounced or absent in older adults. Diabetes in this age group is frequently diagnosed during routine medical procedures or screenings. In adults, diabetes is often associated with obesity, so the condition is more prevalent among older adults, males, and persons of color, and those who have obesity. There are approximately 30 million people that have diagnosed diabetes. However, there's many more that go undiagnosed. Diabetes rates vary across racial, ethnic, and gender groups, and these disparities are primarily attributed to unequal access to healthcare. Additionally, higher average stress levels that are experienced by persons of color can exacerbate these disparities. So it's crucial to note that diabetes is a significant risk factor for susceptibility to other diseases and can impact the outcomes of those conditions. While diabetes is not curable, it can be managed effectively through a combination of lifestyle modifications and medical interventions. The American Diabetes Association recommends a comprehensive management approach that includes dietary changes, such as adopting a low carbohydrate and low calorie diet, regular exercise, maintaining proper hygiene, so paying careful attention to your skin, gums, teeth, and foot care, and medication, which includes taking insulin therapy if necessary. For older adults managing diabetes, it is crucial to address potential memory issues that could interfere with daily testing routines and adherence to management regimens. Fortunately, Medicare coverage includes diabetes education, which makes it easier for older adults to learn effective management techniques. Prevention remains the best strategy against diabetes. So this involves regular monitoring of your weight, blood pressure, and blood glucose levels, and maintaining a wellness-based lifestyle that incorporates exercise and good nutrition. It's important to note that access to these treatments and prevention strategies is not universal. Many people of color and individuals with limited financial resources face barriers in accessing adequate health care and the resources needed for effective diabetes management and prevention. This disparity in access contributes to the higher prevalence and poorer outcomes of diabetes in these populations. Cancer is another common chronic health condition and is the second leading cause of death in the US. Over the lifespan, American biological males have a greater risk of cancer compared to biological females. So biological males in the US have about a 40% chance, and biological females have about a 39% chance of developing some form of cancer. The risk of dying from cancer is about 21% for biological males and 18% for biological females. The risk of getting cancer increases with age due to factors that include declines in immune system effectiveness, cumulative effects of environmental pollutants, genetic changes such as telomere shortening, and structural disparities in healthcare access and health food security. Death rates for most types of cancer have been falling since the 1990s due to advances in interventions. We have advanced radiation techniques and designer genetic treatments now. Many forms of cancer are preventable. Lifestyle factors play a large role in some cancers. Smoking is the leading preventable cause of cancer and other health conditions. Prostate cancer is the second most common form in biological males, and breast cancer is the second most common in biological females. Skin cancers are the most common for both groups. Incidence and mortality rates differ across cancer types and between biological sexes. Given our aging population and declining cardiovascular disease rates, cancer is projected to become the leading cause of death in the US by the early 2030s. This underscores the ongoing importance of cancer prevention, early detection, and treatment advancements. Research in cancer has assessed individual risk for certain cancer types, and we now have a better understanding of the genetic basis of cancer. So for breast cancer, 3 key susceptibility genes have been identified. So these are BRCA1 on chromosome 17, BRCA2 on chromosome 13, and PALB2, which works with BRCA2. And these genes produce tumor-suppressing proteins that repair damaged DNA and maintain genetic stability. However, when these genes mutate, their protein products may not function properly, and they can lead to inadequate DNA repair and increased risk of genetic alterations that cause cancer. So this is why individuals with mutations in these genes have a higher risk of developing breast or ovarian cancer. For prostate cancer, several susceptibility genes have been identified. These include BRCA1 and BRCA2, which is also implicated in breast cancer, as well as HPC1 on chromosome 1 and HOXB13 on chromosome 17. Research suggests that over 150 other genes may be linked to prostate cancer, but definitive conclusions are still pending. The National Cancer Institute provides information on these genetic factors related to prostate cancer risk. Recent advances in genetic research have led to innovative cancer treatments that modulate the immune system response to help fight cancer. Others are to alter the metabolism of cancer cells, which is known as metabolic reprogramming. Also, another one is providing personalized therapies that are tailored to an individual's specific cancer profile. Monoclonal antibodies are lab-produced proteins, and they stimulate the immune system to recognize and destroy cancer cells. At the same time, they also modify cells to enhance the immune system's ability to target and eliminate cancer. These approaches combine immunotherapy, metabolic interventions, and precision medicine to create more effective and customized cancer treatments. Cancer prevention is the most effective approach to combating the disease. The appropriate use of screening techniques and preventative lifestyle changes can significantly lower the rates of most cancers as well as deaths. It's recommended by the American Cancer Society that women ages 45 to 54 get annual breast cancer screenings, and men over age 35 who have a BRCA2 or BRCA1 inherited gene mutation have a clinical breast exam annually. It is also recommended to get colorectal cancer screening starting at age 45, cervical cancer screenings at age 25, and yearly lung cancer screenings between ages 50 to 80 years. There are also dietary and lifestyle modifications that can help significantly reduce cancer. Maintaining a healthy weight with getting plenty of exercise and physical activity can help lower the risk. Consuming a diet with fruits and vegetables, limiting alcohol consumption, staying away from all forms of tobacco, and protecting your skin are dietary and healthy lifestyle modifications that can be implemented to reduce the onset and risk of cancer. Another prevalent chronic health condition is incontinence, and this condition is defined as the inability to control one's urination or defecation. Incontinence affects a significant portion of our elderly population, and according to the National Center for Health Statistics, approximately 60% of women and 40% of men living in community settings have experienced some form of incontinence, with urinary incontinence being more common than bowel incontinence. As individuals age, the likelihood of experiencing either type tends to increase, and there's 4 major forms of incontinence. One is stress incontinence, and this occurs when abdominal pressure exceeds the body's inability to control urine flow. Common triggers include coughing, sneezing, laughing, exercising, or lifting heavy objects. Urge incontinence typically results from the central nervous system. It's often following a stroke or urinary tract infection. Individuals with this type feel a sudden strong need to urinate, but they can't reach a bathroom in time. The third type is overflow incontinence, which stems from improper kidney contraction and leads to an overfilled bladder. This can be caused by certain medications, tumors, or an enlarged prostate. Lastly, there's functional incontinence, and in this case, the urinary system itself functions normally, but a physical disability or cognitive impairment prevents the individual from recognizing or responding to the need to urinate. This form is particularly common in those with dementia, Parkinson's disease, or specific types of nerve damage. Fortunately, most forms of incontinence are treatable with a range of effective options. So, behavioral interventions have shown particular promise in managing this condition, and these approaches include dietary modifications, retraining individuals to recognize bladder and bowel signals, and certain exercises can help strengthen the pelvic floor muscles, which is especially beneficial for stress incontinence. There's also pharmaceutical treatments or surgical procedures that may be necessary to address the underlying causes of incontinence. Pain is another common chronic health condition and affects more than 40% of community-dwelling older adults. For older adults, pain isn't just a sign that something is wrong with their body. It can also cause a lot of other issues too. When older people are in pain, they might feel sad or depressed, have trouble sleeping, or not want to spend time with friends and family. Pain can also make it harder for them to move around easily. All of these problems can lead to older adults needing more medical attention, which can be expensive. When we think about pain in older people, we need to remember that it's not just about physical discomfort. It can affect many parts of their lives, from their mood to their social life and even their wallet.
This program is presented by the Centers for Disease Control and Prevention. Welcome to A Cup of Health with CDC, a weekly feature of the MMWR, the Morbidity and Mortality Weekly Report. I'm your host, Dr. Kathleen Dooling. Occasional aches and pains are an expected part of life, but for many people, pain is a constant companion. Dr. Chad Helmick is with CDC's National Center for Chronic Disease Prevention and Health Promotion. He's joining us today to discuss ways to manage chronic pain. Welcome to the show, Chad.
Thank you.
Chad, how many people in the U.S. suffer from chronic pain?
In 2016, 50 million adults had chronic pain, which is pain on most or every day in the past 6 months. More interesting, though, is that 20 million people have high-impact chronic pain, which is chronic pain that also limits their work or life activities on most or every day in the past 6 months. This is a problem because chronic pain is associated not only with symptoms, but with anxiety and depression, reduced quality of life, and the risk of opioid problems.
What are the most common causes of chronic pain?
The most common causes generally relate to bones and joints, like low back pain and arthritis, but there are many other causes: headaches, sickle cell disease, fibromyalgia, surgery and injuries, and many, many others.
Is chronic pain more common in any particular group of people?
Yes, it occurs at all ages, but it's more common in older middle-aged adults and in the oldest old, 85 and older. It's also more common in women, poor people, and those who live in rural areas.
How is chronic pain treated?
Well, the first thing to do is to get a diagnosis, which can help guide treatment. But the thinking about chronic pain now is that it becomes a chronic disease by itself, regardless of the cause, and that can cause significant problems. The real goal in management is to have a manageable level of pain, not to get rid of all pain. There's several steps that can be taken, and these are sometimes difficult to do because of barriers to access. But it makes sense to do the simplest and safest things first. And these are non-drug steps. Things like physical activity. Walking is perfectly good to help reduce pain. Also, self-management education can give you some confidence in managing chronic pain when you're on your own. There's also physical therapy, occupational therapy, psychological therapy, better sleep, which usually means less alcohol, and seeing a chiropractor or getting biofeedback and massage. If that's not enough, non-opioid drugs like Tylenol or Motrin and Advil or Naproxen or Aleve can help. If those don't work, then it's time to consider something stronger. Sometimes that's opioids, but there's not great evidence that opioids are good for long-term pain in most people.
Do you have any advice for people suffering from chronic pain?
Well, it's important to work with a variety of providers who are working together to help you. The goal, again, is manageable pain so you can live a productive life. This can include physical therapy, most people can walk, to treat any underlying depression or anxiety, and to avoid further injuries. Finally, the National Pain Strategy is laying out a strategic roadmap to improve pain management system in this country.
Where can listeners get more information about managing chronic pain?
Listeners can go to the NIH website, nih.gov, and type in National Pain Strategy.
Thanks, Chad. I've been talking today with Dr. Chad Helmick about ways to manage chronic pain. If you're experiencing daily pain, talk with your healthcare provider to ensure you have the correct diagnosis and know how to manage your condition. Until next time, be well. This is Dr. Kathleen Dooling for A Cup of Health with CDC.
For the most accurate health information, visit cdc.gov or call 1-800-CDC-INFO.
There are two main ways to manage pain. One is using medications, and the other is using alternative methods that don't involve drugs. Doctors often use both together to help people feel better. When it comes to medications, there are two types. For mild or moderate levels of pain, doctors might suggest simple pain relievers such as ibuprofen or acetaminophen. These work well for things like arthritis pain, but older people need to be careful because these medications can sometimes cause problems. For severe pain, doctors might use stronger medications such as opioids, and these include drugs like oxycodone, hydrocodone, and morphine. And some of these strong medications work well for older people, but for others it might not be safe because older bodies process drugs differently. It's really important for physicians to keep a close eye on patients taking these strong pain medications because there is a chance that people could become addicted to them or use them in a harmful way. Medical treatments for back pain include a variety of methods. So some common approaches are taking cortisone shots to reduce inflammation, radiofrequency neurotomy, which uses heat to disrupt pain signals, implanted nerve stimulators that block pain signals, and using surgery to fix spinal problems. There's also new treatments that are being developed, such as 3D printed implants and using tiny technology to help grow new tissue. There are also many ways to manage pain without surgery or drugs. These would include physical therapy, skin treatments such as getting a massage or applying heat or coldness to the affected area where you're experiencing pain, electrical stimulation, acupuncture, biofeedback, distraction techniques such as listening to soft music, relaxation, meditation and visualization, and hypnosis. Biofeedback is where a person learns to control and change their bodily processes that are responsible for the pain. As people age, they tend to use more medications than any other age group. On average, older adults take about 6 or 7 different medications, including both prescription and over-the-counter drugs. Most of these are used to manage ongoing health issues, and until recently, new medications weren't always tested on older people or diverse groups, so we're not always sure how well they work for everyone. As we age, our bodies process medication differently, which can change how much we need to take. This might mean a higher risk of taking too much or needing more to get the same effect. Because of this, doctors might be extra careful when giving medications to older people. In the US, the cost of prescription drugs is a big issue, especially for older adults with less money. Even with Medicare insurance, the costs can be high and confusing. As people develop more health problems with age, they often need to take more medication to stay healthy and maintain their quality of life. It's a complex situation that affects many older adults' health and finances. So we'll go over some developmental changes in how medications work once they enter the body. Absorption is the time it takes for a medication to enter your bloodstream. For oral medications, this mainly depends on how quickly the drug can move from the stomach to the small intestine where it is absorbed the most. In older adults, this process can take longer, which might mean less of the drug gets absorbed, making it less effective. However, once the drug reaches the small intestine, older and younger adults absorb it similarly. Because how much drug is in the body is crucial for effectiveness and safety, doctors need to monitor drug levels closely to prevent overdoses or side effects. Age, gender, weight, and other factors can influence how much of a drug is needed. The liver helps break down and clear drugs from the body, which is a process that tends to slow down with age. This means that drugs stay in the body longer in older adults, which can increase the risk of side effects. Drugs are also removed from the body through the kidneys, and because kidney function can decline with age, drugs might not be eliminated as quickly, which leads to a buildup and potential toxicity. Given these age-related changes, older adults may need different dosages of medication compared to younger people. Often, physicians start with lower doses and adjust slowly to find the right amount. This strategy is known as the start low and go slow strategy. In some situations, medications can be avoided in older adults due to the risk of adverse effects. When someone is treated for several conditions at once, they often end up using multiple medications, which is also known as polypharmacy. This can be risky because different drugs might not work well together. Some combinations can make a drug too strong, while others might make it ineffective. These drug interactions can cause new health issues that require treatment and can make the original condition harder to manage. Additionally, drug interactions can produce symptoms similar to other diseases, such as confusion and memory loss, which can be mistaken for dementia. It is important for healthcare professionals and family members to closely monitor medications. Older adults often use more medications, so it's important to reduce the risk of drug interactions. It is also important to keep accurate records of all medications and consider both the risks and benefits of each medication. If necessary, healthcare professionals should explore alternative treatments such as behavioral strategies. The goal is to use medications only when necessary and avoid causing additional problems. For medications to be effective, it's crucial to take them exactly as prescribed, and this involves remembering to take them on time and in the right way. However, as the number of medications and complexity of treatments increase, it becomes harder for people to take their medications correctly and on time. This challenge is even greater for older adults due to forgetting to take their medications. And this is due to changes in their sensory, physical, and cognitive abilities. Remembering to take medication at a future time, which is known as prospective memory, is crucial for sticking to a medication schedule. However, people over 80 struggle with this because they simply forget. Aside from basic adherence, another important concern is whether older adults differ from younger people in their ability to notice, remember, and report side effects from medications. Research shows that while older adults can recall severe side effects as well as younger adults, they may struggle more to remember and distinguish critical side effects from less important ones. This can lead to delays in contacting their healthcare provider if serious side effects occur. Technology can help with medication adherence. So, for example, smartphone apps that track medication schedules and monitor health indicators are increasingly used in telemedicine to ensure that medications are taken as prescribed and to support overall health management. Ideally, the number of medications should be kept as low as possible to reduce the memory burden. When medications are necessary, they should be reevaluated periodically and discontinued when no longer needed. Older adults should receive the same careful attention to medication management as any other age group. Disability in the context of chronic conditions refers to how these long-term health issues impact a person's ability to do everyday activities that are important, expected, or desired in their society. For example, someone with a chronic health condition might find it hard to handle daily tasks like cleaning the house, taking care of themselves, working, enjoying hobbies, socializing, or running errands. A major focus of research on health and aging is to understand how chronic health conditions lead to disability and how to prevent it. Researchers are interested in a concept called compression of morbidity, which means that people are experiencing disability later in life and for shorter periods before they die. This suggests that older adults are becoming disabled closer to the end of their lives than in the past. However, evidence for this idea is not strong. In reality, chronic health conditions are being diagnosed earlier, and although people live longer with these conditions, advances in healthcare and technology are what are helping them manage them better. Disability from chronic conditions and normal aging still occurs, but it varies. Verbrick and Jett developed a detailed model to explain how chronic conditions lead to disability, which has had a big impact on research. The model has 4 main parts. It shows how chronic conditions affect body systems, which then limit a person's ability to do activities, leading to disability. The model also includes risk factors and 2 types of intervention strategies. Risk factors are long-term issues or behaviors that increase the chances of disability, such as low income, chronic health problems, or unhealthy habits like smoking. Intervention strategies fall into 2 categories. 1, extra-individual factors and intra-individual factors. Extra-individual factors are external supports like surgery, medications, social services, and environmental aids that help people stay independent. Intra-individual factors involve personal actions such as exercise routines, maintaining a positive attitude, and using available transportation services to improve mobility. Both types of interventions aim to reduce the impact of chronic conditions, but sometimes they can cause new problems. For example, a medication might have side effects that create additional issues, or a social service might have rigid rules that make it hard for someone to access the help they need. These problems, known as exacerbators, make the situation worse and require further intervention. An important part of the model is how well a person's needs match with their environment. If the environment supports their needs, their quality of life is better. If not, it can lead to significant stress. To understand how well an older person is functioning in daily life, we look at their functional health status. This is based on a model that shows how people lose abilities over time, which is called the hierarchy of loss. Usually people first have trouble with tasks that need strength and balance, and later with tasks that need hand skills. This idea led to a worldwide system called the International Classification of Functioning, Disability, and Health. It helps us see how health, environment, and personal factors all work together to affect a person's abilities. Some older adults become frail, meaning they need help with everyday tasks due to health problems or disabilities. In the US, about 5 to 17% of older adults are considered frail, depending on how it's defined. This is becoming a global issue as family structures and care systems change worldwide. Researchers have developed ways to measure how well older people can do everyday tasks. They look at 3 main areas. 1 is the activities of daily living. These are basic tasks like eating, bathing, using the toilet, walking, or getting dressed. If someone needs help with these, they might be considered frail. 2nd is instrumental activities of daily living. These are more complex tasks that require some thinking and planning. In Western countries, this might include shopping, paying bills, or taking medications correctly. In other cultures, it could be things like taking care of animals or making bread. 3rd is physical limitations. These are activities that show how well someone can physically function, like walking a short distance or sitting for a while. As people get into their 80s, they're more likely to have trouble with these tasks, especially as they near the end of life. Studies show that older Black and Latino adults often face more difficulties with these tasks than white adults, even if they have similar income levels. This suggests that money alone doesn't solve the problem and that racism and discrimination play a big role. Also, frail older adults are more likely to feel depressed or anxious. Understanding these issues helps us provide better care for older adults who need assistance. As people get older, many face challenges with their health and ability to do everyday tasks. This happens all over the world, not just in the US. The United Nations says about half of all older adults globally have some kind of disability. Women and individuals in poorer countries are more likely to have disabilities. People with disabilities often face unfair treatment and barriers in society, which can be even harder for older people. To help with this, the UN created rules for countries to follow to protect people with disabilities. They want to make sure that older people and those with disabilities can fully participate in society. This includes making places easier to access, helping people live independently, and improving healthcare. The UN has a big plan called the 2030 Agenda for Sustainable Development. This plan aims to improve life for everyone, including older people and those with disabilities. It focuses on reducing poverty, improving health, creating better jobs, and building cities that work for everyone. As people live longer, more people with disabilities are reaching old age. This means that countries need to plan for the future by designing communities that work for everyone, regardless of age or ability. The UN believes that to create a fair and successful world, we must include older people and those with disabilities in all of our plans and decisions.